Hi friends, welcome to Nursing Online Education. In this video we will be discussing important questions and answers of different nursing competitive examinations. Guys, let's get started. Here is our first question. Prior to providing care for a hospitalized infant, the nurse who focuses on preventive measures must. And the options are: A. Introduce self to parents. B. Perform hand hygiene. C. Have a witness present. D. Assess the child's developmental level. I repeat, the options are: A. Introduce self to parents. B. Perform hand hygiene. C. Have a witness present. D. Assess the child's developmental level. The right answer is option B. Perform hand hygiene. Here is our next question. A patient is preparing for a total knee replacement. During the preoperative interview process, the patient reports an allergic reaction to penicillin. Which of the following is considered a side effect and not a true allergy to medication? And the options are: A. Shortness of breath. B. Tingling lips and tongue. C. Rash. D. Upset stomach. I repeat, the options are: A. Shortness of breath. B. Tingling lips and tongue. C. Rash. D. Upset stomach. The right answer is option D. Upset stomach. Here is our next question. A patient is recovering from surgery using spinal anesthesia. The patient developed a spinal headache. Which of the following nursing actions would be most appropriate? And the options are: A. Elevate the head of the bed 30 degrees. B. Keep the patient well hydrated. C. Limit intake of salty foods. D. Lower the temperature of the room. I repeat, the options are: A. Elevate the head of the bed 30 degrees. B. Keep the patient well hydrated. C. Limit intake of salty foods. D. Lower the temperature of the room. The right answer is option B. Keep the patient well hydrated. Here is our next question. A 19-year-old woman telephones the nurse and complains of difficulty of breathing. The symptoms developed while exercising that morning. She has a productive cough with thick mucus secretions and wheezing. The nurse hears that the breathing problems do not interfere with talking on the phone. The woman plans to attend the clinic but must wait for 2 hours before she can be driven there. Which treatment should be recommended first by the physician? And the options are: A. Pursed lip breathing. B. Deep breathing and coughing. C. Decrease physical activity. D. B2 agonist administration. I repeat, the options are: A. Pursed lip breathing. B. Deep breathing and coughing. C. Decrease physical activity. D. B2 agonist administration. The right answer is option C. Decrease physical activity. Here is our next question. A patient with Alzheimer's disease and severe cardiomyopathy presents to the hospital with a fractured left hip. The patient is on bed rest until a cardiologist clears the patient to have surgery. Which nursing diagnosis have the highest priority? Nursing diagnosis: A. Impaired physical mobility. B. Activity intolerance. C. Alternation of comfort. D. Risk of alternation in skin integrity. E. Knowledge deficit. F. Decreased cardiac output. And the options are: A. E and F. B. D and C. C. C and F. D. D and F. I repeat, the options are: A. E and F. B. D and C. C. C and F. D. D and F. The right answer is options C, and F. Here is our next question. A patient with diabetes mellitus and multiple sclerosis has been prescribed baclofen lioresal. The nurse knows this medication may result in, and the options are A. Increased insulin needs, B. Renal failure, C. Optic neuritis, D. Muscle tremors. I repeat, the options are A. Increased insulin needs, B. Renal failure, C. Optic neuritis, D. Muscle tremors. The right answer is option D. Muscle tremors. Here is our next question. A community health nurse visits a patient who had a cerebrovascular accident. The patient is at risk for deficient fluid volume due to voluntary reduction of fluid intake to avoid the use of the bathroom. The nurse educates the patient on the importance of drinking fluids and maintaining hydration. Which of the following indicates the efficacy of the nursing intervention? And the options are A. Amber color urine, B. Respiration of 35, C. Tachycardia, D. Moist mucous membrane. I repeat, the options are A. Amber color urine, B. Respiration of 35, C. Tachycardia, D. Moist mucous membrane. The right answer is option D. Moist mucous membrane. Here is our next question. An adolescent patient with a history of migraine headaches for the past year has been followed for pain management. The headaches have decreased in severity and now occur only occasionally. What are the best 3 long-term goals? Goals for the next 3 months. The patient will A. Not have any migraine headaches. B. Decrease the number of migraine headache. C. Learn to tolerate her migraine headaches. D. Continue to take prescribed preventative medications daily. E. Initiate complementary pain management strategies as needed. F. Wean self from all pain medications. G. Keep a pain diary and recognize triggers and auras before migraine headaches commence. And the options are A, D, F, B, D, F, C, E, F, D, E, G. I repeat, the options are A, D, F, B, D, F, C, E, F, D, E, G. The right answer is option C, E, F. Here is our next question. After a hearing restoration operation, a patient has no signs of complications and soon recovers. Which of the following is an expected outcome 5 days after the hearing restoration surgery? And the options are A. Regain full hearing, B. Minimal facial nerve paralysis, C. Minimal urinary incontinence, D. Ambulates without difficulty. I repeat, the options are A. Regain full hearing, B. Minimal facial nerve paralysis, C. Minimal urinary incontinence, D. Ambulates without difficulty. The right answer is option A. Regain full hearing. Here is our next question. A nurse is caring for a 3-year-old child with a fractured arm. Which of the following interventions is the most appropriate for pain management? And the options are A. Administer analgesics when necessary, B. Assess pain once a shift, C. Anticipate pain and intervene early, D. Encourage the use of self-quieting techniques. I repeat, the options are A. Administer analgesics when necessary, B. Assess pain once a shift. C. Anticipate pain and intervene early. D. Encourage the use of self-quieting techniques. The right answer is option A. Administer analgesics when necessary. Here is our next question. The nurse is measuring the chest tube drainage of a patient who had open heart surgery 4 hours ago. Which of the following is the maximum hourly amount of chest tube drainage is expected in this time frame? And the options are A. 100 milliliters, B. 200 milliliters, C. 300 ml, D. 400 milliliters. I repeat, the options are A. 100 milliliters, B. 200 milliliters, C. 300 ml, D. 400 milliliters. The right answer is option B. 200 milliliters. Here is our next question. A patient is being followed in the clinic for hypertension, adult-onset diabetes, and obesity. The patient is apathetic about learning about nutritional guidelines to reach the goals of weight loss and consumption of a healthy diet. The patient admitted to eating whatever is put in front of me. Which of the following actions would the nurse take? And the options are A. Collaborate with the patient to set goals, B. Add a nursing diagnosis of non-compliance, C. Refer for psychiatric screening for depression, D. Discuss nutritional interventions with the spouse. I repeat, the options are A. Collaborate with the patient to set goals, B. Add a nursing diagnosis of non-compliance, C. Refer for psychiatric screening for depression, D. Discuss nutritional interventions with the spouse. The right answer is option D. Discuss nutritional interventions with the spouse. Here is our next question. A 35-year-old man is hospitalized following a blunt chest injury. He has chest pain, breathing difficulty and asymmetrical lung expansion. Chest auscultation reveals decreased lung sounds on the left side. The jugular veins are distended and there is tracheal deviation to the right. Blood pressure 92/54 mmHg. Heart rate 120 per minute. Respiratory rate 24 per minute. Temperature 36.2 C. SAO2 88% on oxygen. Which initial intervention is most appropriate? And the options are A. Send patient for X-ray examination, B. Administer bronchodilators, C. Administer intravenous fluid bolus, D. Prepare for needle decompression. I repeat, the options are A. Send patient for X-ray examination, B. Administer bronchodilators, C. Administer intravenous fluid bolus, D. Prepare for needle decompression. The right answer is option A. Send patient for X-ray examination. Here is our next question. A 55-year-old man presented to the clinic with complaints of numbness and tingling in his feet for the past 3 months. He appears thin and his skin is pale. Examination confirms the loss of vibration sense. He also has altered proprioception. He had a subtotal gastrectomy 2 years ago. Let's see the lab results. MCH 2.72 normal values is 1.45 to 2.01 FMOL cell. HCT 0.31 normal values is 0.41 to 0.50. MCV 105 normal values is 81 to 97 FL. Reticulocyte count 1.5. Normal values is 0.5% to 2.5%. Which supplement would most likely improve his condition? And the options are A. Iron, B. B12, C. Folate, D. Calcium. I repeat, the options are A. Iron, B. B12, C. Folate, D. Calcium. The right answer is option B. B12. Thanks for watching. Subscribe for more videos.